I wanted to ask a follow-up question because you kind of mentioned it a little bit, Graham, with you. It sounded like you had a few reservations when you started PrEP. So what was it? What did your doctor explain to you that kind of made you lean towards going ahead and getting on PrEP anyway, just despite your reservations?
Well, basically, my doctor explained to me that, first of all, the reality that I stand in. I got tested by at my first doctor's appointment. I tested negative, and she said, look, the fact that you are someone who you're gay, you are testing negative, PrEP, you're a good PrEP candidate, right? I was thinking that PrEP was for people who were at a quote unquote high risk for contracting HIV. And in my head, I thought that that meant if you were someone who had a lot of sexual partners, and granted, it's for that person too who's HIV negative. But for me, I thought, I was not someone who had a lot of sexual partners. And I just thought, maybe this isn't for me. I was also very, I want to say, conservative about taking medication as well. I'm fortunate enough in life that I think the only condition I'm living with is asthma right now, and even that is pretty much controlled. I don't take many medications. So the idea of taking a pill every day, I thought that I'm wondering if there's any long-term side effects of that. My doctor sat down with me and spoke about any possible side effects. And the way she explained it to me was that, of course, PrEP is an antiretroviral medication. And I think when I started, I don't think Descovy was as what was approved yet for PrEP. So I think at that point it was only Truvada. And at that point there were discussions about, Truvada and, people having kidney issues. And the way that my doctor broke it down to me was that, there have been kidney issues noticed in people that were using it for HIV maintenance. But she said that from her practice, when it came to people using it for PrEP, she really was not seeing any of her own patients that were coming back with any kidney issues or bone density loss. So those are some of my concerns. And then also just the fact that in my head, I'm gonna be honest with you, like I was saying, this is how I think one of the ways that trauma really affects your life. I always thought of HIV as being either this specter, this sort of wagging finger in the back of my head saying, you better not do this, you better act right, you better behave, or else this could be something that comes and changes your life. Um, and at worst, I thought of it as being almost this inevitability. If I really admit it to myself, I really thought of it as almost this inevitability, as me being a gay man, that like at some point this could be something that enters my life. So the idea that there was this pill that could come and really alleviate a lot of that stress that could protect me after, I am a child of the 90s, right? Grew up in the 90s and the early 2000s. After hearing all of the safe sex talks, all of the pro condom, wear a condom talks, I just thought like, this little blue pill, like really? So I almost, and again, trauma, this is where the trauma works, right? I almost on a certain level did not believe it. So my doctor really helped talk me through all of that.
We need more physicians like that want to talk to their patients about PrEP. That's a major issue, especially you mentioned for in the gay community. And I know that the disparity of PrEP use is very pronounced amongst Black and Latino gay men, Latinx gay men, and also with Black and Latinx women. The disparity is even crazier. A lot of doctors don't even mention PrEP to actually women in general, don't even have to break it down to Black or Latinx. Doctors are not really mentioning PrEP to women because they don't see the risk to women. Thank you so much for that. Did you want to add something, Brandon?
Yeah, I would, if that's okay. I just, I had my experience was a little different because obviously here in Tallahassee, small city, and so there are not a lot of physicians that look like myself. And even on, even trying to attempt to find a physician, And I love my primary care physician now. She's awesome. But for me, I do not, get my sexual health care provided through her. I actually go through one of our community-based organizations here, because interacting with my doctor, I started seeing her like in 2016, and she's a white woman. Like I said, really, really, really sweet. But when I first started coming there, she never had a conversation with me. And at that time, I was working at the state health department, so I knew, like, okay, like, I would always advocate for myself and say, hey, I want to go ahead and get tested. I want to go ahead and, do this. And she would say, okay, well, I test, twice a year, the generic kind of thing. And so then, upon, going to her for a while, I took it upon myself to talk to her about PrEP. And so now she's empowered to speak to her patients about it. But for me, I go to one of our community-based organizations here because I just feel like the care there is a little bit more specialized, right? So it's a, non-judgmental place. I don't feel like I'm tensing up when I go in there, like, as opposed to me sitting in my PCP's office where I'm just kind of like, nobody even looks like me in here, but I still go to her for some of those primary, for some of those primary needs. And so take advantage of the community-based organizations and the FQHCs that are out here that are providing this as well, because they do provide an excellent space for you to be able to come into a non-judgmental place, to really just have a very honest conversation about your sexual health. And so for me, it wasn't so much of the reservations because I knew what I needed to do to get on it, right? But it was just like, just navigating again the landscape to find the best home that was going to suit my needs for my sexual health matters.
Thank you for sharing that. A lot of our community or based organizations, our FQHCs, they are so important when it comes to the overall health of our communities, because not everyone has access to a PCP or like a provider that they see on a semi-regular basis. Some people rely on those community-based organizations. And so it's good to hear that you are taking advantage of those types of providers in your area, our area, because me and Brandon both live in Tallahassee. So you both kind of mentioned about some of the side effects and some of the screenings that you have to do. So when I educate people about PrEP, I like to talk about it as being more than just a pill. It's kind of like a system that you have to follow, because you have routine HIV and STD screenings, you have to do your kidney function tests and such. So what has been your experiences with your follow-up appointments and the routine testing? How has that been for you?
I guess I'll go ahead and start off too. It's been pretty okay for me. I will share this. So about a year into me taking Truvada, because of these follow-up methods, right? So you have to go every 3 months. You're tested. Creatinine is checked. My physician noticed that my liver enzymes were a little elevated. And so at that point, that was just kind of like, okay, what's going on here? So we kind of went through a whole, for me, I was just like, well, I know I haven't been exposed to like, hepatitis and stuff like that. So I started kind of thinking like, okay, going through these procedures as well. But we were able to kind of, we were able to find out just by consultation with another pharmacist that it was the Truvada that was causing my liver enzymes to just kind of be elevated. They weren't like through the roof or anything of that sort, right? But they were just a little elevated. And so at that point, it was like, okay, so this is causing some of these, small little issues. Like, let's go ahead and get you moved over to Descovy. And when I moved over to Descovy, didn't have this issue. Now I have friends who've been on Truvada and they don't have any types of issues. So it's really all about finding like kind of what works for you, right? And so that I just kind of wanted to share that little nugget as well. But it's that kind of happened to me. And because of that routine check, we were able to catch that, right? And we were able to say, okay, something's kind of going on here. Like, let's go ahead and, switch over. So I always tell people that if you're starting PrEP, and I think that you explained it perfectly, Shayla, that it is a system that you have to kind of, hopefully that that home or that organization that you're receiving your PrEP from, they have some type of system in place to notify you and let you know. But you also have to be, again, empowered, going back to what I spoke about, to be on top of your stuff as well. So I don't simply rely on these things. I know when I need to go too. I'm always checking at that 3rd month mark to make sure that I can go, so that way I can get my additional refill, and so that way I have everything that I need on hand. But it is untraditional, right? That you're going into this space and then you're being tested and things of that sort. But for me, it's comforting in knowing that whenever I'm in, again, if I'm engaging with somebody or starting a new partnership, I can confidently come into that and say, I was tested 2 months ago, 3 months ago, right? And it gives me that kind of, pass, I would say, to come in and say, you know what, I'm aware of this. Maybe, if you're not, then, we could possibly consider something like that. But it is untraditional. It is a system. It is something to get used to. I still find myself to date, actually, in a frenzy when that time comes around to go. And sometimes I might have to say, okay, I have this going on, or a grant or some type of deadline due, and I have to switch those dates around, but I'm still adamant, and I make sure that I actually go to those appointments in order to make sure that I'm keeping in check with everything that's going on in my body.
Thank you. Did you want to add anything, Graham?
Not much really. I had a pretty great experience when it comes to my doctor's office. I have I think it's called the Healow app, which I really love. I'm able to see all of my lab results as soon as they're posted, and I'm able to also write messages to my doctor for anything really, almost anything health related that that she and I have discussed. But yes, no, it's been great. The just being able to, I mean, of course I'm getting tested for HIV. For me, it's every 3 months. But I'm also getting tested for most of the other well-known STDs that are out there as well. So again, it makes things a lot more easier for me to, have that conversation about. So I know that I'm negative for HIV, and I also know that I am negative for all these other STDs because I have that record right literally in my phone. And that's one thing that I do want folks to know, that if you are a PrEP patient, if you're someone that's taking PrEP, or if someone says that they are taking PrEP, it's not just simply I'm taking this medication to prevent contracting HIV. It's also that I'm going to get tested for HIV at a particular frequency throughout the year. And it's also that I'm getting tested for these other STDs too. Now, of course, PrEP does not protect against the other STDs that are not HIV. But if you are, I think best practice is that physicians should be testing for these other STDs as well.
I definitely agree. That's what I talk to people about when they ask me about PrEP. I was like, it's not just about like taking the pill. It's literally adding an entire, people say adding another tool to your toolbox. Well, like, I don't know much about tools, but those little things that like hold little things that you put on top of the toolbox and you lift it up and there's like the deeper part, whatever that's called, that little tray, like PrEP system is like
underneath there.
Underneath there. That's what this whole PrEP system is, really your whole toolbox. Like, it's providing you with, routine testing and screening, providing you with PrEP medication, seeing your provider on a regular basis. That's like a whole toolbox in itself to, guarantee your sexual health and your overall health. So I want to talk a little bit about adherence, because one thing that, that a lot of people have a little bit of pause about is having to take a pill every day. You mentioned a little bit, Graham, like when you're a person that maybe not could be considered, as you say, quote unquote, high risk, do I want to take a pill every day? Am I going to be able to take a pill every day? And the thing about PrEP is that it's most effective if you take it as prescribed for at least 7 days. So I wanted to ask, have either of you had any issues with adhering to your PrEP medications?
Oh, I have personally. I will say that there have been I've had my nights when I'm going out with friends, and I one point I remember like 9 p.m. was my time. 9 p.m. was always my time that I would take my PrEP. So I would take it at the end of the day. But then if I was, out late, having some drinks with friends or going to a bar, what have you, I would forget. And then I'd probably come home feeling a little tired, and then I would miss that dose, right? I've never missed more than one dose. I would say as of this point, I've never missed more than one dose. So I know that it does happen, but again, even with education, and Dr. Brandon, correct me if I'm wrong, but while the best practice is to take your dose of PrEP once a day, every day, if you miss one dose, it's the efficacy does only go down slightly, and I think it still stays at around 90%. I think it's still effective if you miss a max of about 5 doses, if I'm correct. 5 doses in a row. You don't want to do that, but if worst comes to worst, you can still get a high efficacy if you miss up to 5 doses in a row. So that's what I will say about when it comes to me staying on the pill every day.
Yeah. So Graham is right. In terms of just what we would call like a therapeutic threshold, right? Like that it does build up in the system, and it is there, even if you miss a dose or two, right? You don't want to exceed anything like, 4 or 5 or like a week, right? If you kind of go into that ballpark, then you definitely want to go ahead and speak with your doctor at that point. And so for me, yes, I have had missed doses, and usually I'm able to like drill down exactly what causes this. So it could be, if I'm out, or if I'm having a busy day, right? And then I go home and I have a drink, maybe a drink or two, and then after that, I'm just usually like, okay, I don't want to take the medicine on top of me drinking, so I'll just go ahead and take it before I go to bed. And then I will forget. And then so the next day I'll kind of wake up and be like, oh man, I missed the dose. But if I miss it, that's okay. I just kind of pick up exactly where I left off, and I still continue on the regimen. Like I don't just say, okay, missed it, I pick right back up and I just continue to take it. And that is what is recommended. If you, it's gonna happen. Life happens, things get in the way. You may be out on the weekend. Again, for me, it's a combination of mixing alcohol and drinks, and so alcohol and medication, excuse me. And so for me, it was just kind of like, all right, I don't want to do that, and then me procrastinating will then kind of result in me missing a dose. But if you do miss it, it's okay. Just pick back up, and you just continue to take it as prescribed once a day.
Thank you. I'm terrible. I'm not taking PrEP, but if it were, indicated for me, I definitely would take PrEP. But I take other medications, and I am terrible about forgetting it sometimes. So what I've trained myself to do, and it helps me, is I keep my medication on my nightstand. So when I'm getting in the bed, I can't help but see it. I have to see it because I have to plug my phone up right there. I always have water on my nightstand. So I'm always like, okay, let me take my medicine, because I always forget about it. And I mean, don't tell my doctor. Sometimes I like consciously, I'm like, I'm not taking it. I don't feel like it right now.
Yeah. And one thing I will also add, if it's okay, Shayla, is that, if you also take other medications now, depending on what type of medication it is, usually there's not any contraindications with PrEP, right? And so if you're taking other medicine, what helps me is like, I'm taking a multivitamin. And so I'll take a multivitamin and I'll just take my PrEP right then and there, right at the same time. And that usually helps me a lot, because I will, then that kind of reminds me, okay, when I'm putting something in my mouth, that I need to take my other, my other tool as well, right? So that helps too.
Thank you. So go ahead.
Sorry, I was gonna say something. I mean, I literally go through a phase, and sometimes I still do it. Like when I'm in my bathroom taking my medication, I'll do a silly face in the mirror. So if I'm have a random moment in the day where I think, did I take my medication? Yeah, I did. Like I stick out my tongue or something. It's just a weird little thing that helps with my memory, because sometimes you just randomly forget in the day.
I'm actually going to implement that in my life.
That sounds good.
My memory is terrible. Like my memory is not that great anyway, but I'm definitely going to try that. So thank you for it. You heard it first from Graham. make a face in the mirror to remember something. I got you. Thanks for that. So I heard it mentioned a couple of times through our conversation thus far about stigma. And many people, especially in communities of color, they're apprehensive not just about PrEP use, but even talking about HIV care, the possibility of being HIV positive. There's a lot of conversations about that in our respective communities. So we know that PrEP use is stigmatized. So have you yourself experienced any stigma from taking PrEP, or due to you taking PrEP?
I would say, Graham, were you going to say something first? Go ahead.
I guess in short, I will say no right now. I do remember before I started taking PrEP and when I just knew about it, like there was the stigma of and pardon me for indelicate language, but there was a stigma of the quote unquote Truvada whore. And basically it was this idea of, people who are taking PrEP know that they're going to be having a lot of sex, they're going to be having a lot of partners, and that's why they're deciding to take this medication. I've spoken to close friends of mine. In my recent life, I've been blessed to have a close circle of gay male friends who we talk openly about PrEP, we talk openly about status and testing, and it has not been a thing in my time. And now again, I started PrEP fairly recently in 2019. So that stigma of being someone on PrEP, I have not experienced it personally, but I have learned about how when it first came on the market in about 2012, like folks were creating their own urban legends and what have you about PrEP. So
Yeah.
Very true.
And, yeah, so I would say the same. My experience has been pretty much the same. I haven't really had any stigma, but I do know a lot about the stigma that obviously was attached with it. And I will say that there maybe are still some subtle like stigma that goes along with it, because I think, obviously folks are tied into being promiscuous, having multiple partners. And I've even heard folks say this in focus groups or like research that I'm doing to date, right? But personally, I've not experienced it. I will say that I, again, receive a lot of questions, right? So I'm in a relationship now, and so when I first started dating my partner, he had questions about why, why are you on PrEP and stuff like that. And then I had to kind of, say, all right, am I going to continue PrEP like with him, or am I going to stop this, right? Like trying to, kind of analyze my own risk. And I was like, I'm just going to go ahead and continue it, right? Because it, again, provides me with that empowerment, provides me with the options, it provides me with the protection. And so he understood that, but it did warrant, like it did kind of bring up a lot of questions. And so that's okay, that's normal. And I think that happens a lot. And so don't shy away from that, encourage it. And even prior to me being in a relationship, again, it would be a starter for a lot of conversations, because then what I started to figure out was that, the folks that I was talking to who weren't on PrEP, that they really didn't perceive themselves to be at risk. Now, we're meeting, right? We're about to possibly hook up, and you don't think that you're at risk. I'm pretty sure, I mean, I don't want to be judgmental, but I'm sure that folks are probably doing this with other folks too. And so why haven't you considered this? So for me, I would just use it as a moment to just kind of put my little plug in about it and just say, you know what, I'm going to leave this encounter and I'm going to go home and sleep just fine, right? And not be worried about anything. And I think that that's what I wasn't able to do prior to PrEP. Like I would be like, oh my God, like, I would kind of be thinking about things after the fact. And because we're just kind of in the moment, right? And nobody's kind of thinking about these things in the moment. So that's just my little 2 cents there about that. But no to the stigma, and we need to normalize having these conversations. Get a good group of folks, like Graham has said, that really you can have these conversations honestly and just openly about it and really be transparent. And so I feel like we need to normalize that conversation around PrEP.
I definitely agree as well. My friends will tell you that I am not shy to talk about it. I will always bring it up. If we get to that portion of the conversation, I'm going to be the one to bring it up. I'll do it. It's fine. But we definitely have to normalize talking about it. Did you want to add anything else, Graham?
No, I'm good.
Okay. So at this time, I'm going to go through our chat box, and we have a couple of comments and some questions. So I'll read this one comment. It says, "This is what I'm worried about. I am new in my role as a research coordinator for RAIN in Charlotte, North Carolina." Welcome, North Carolina. "I am a white heterosexual woman who has a public health background. I have special interests in health disparities, but don't want to come across as some white chick telling clients what to do. I truly love what I do and the information in the HIV field, but I am struggling in my own skin. How can I come across as relatable to my clients, even though I may not look like them, live like them, etc.?" Do y'all want to start? I'll take a stab at it, but you can go ahead and go, Randy.
Yeah. I think that it's just it is delicate, right? And I think that it is very good that you're aware that you don't want to do that, because some folks aren't even aware and they just they just kind of do it, right? So I think that your awareness is obviously key to that. I just really, for folks who have talked to me about these different things, I think it's really just a matter of you just really coming across very sincere, and even being, telling, possibly giving stories about your friends and things of that sort. I always find that helps people to also connect folks with others who may be using PrEP, or they may know somebody or something like that, right? And so I do have a lot of white friends as well that feel that way, and they have shared this with me. And I'm just like, just as long as you're, for me, sincere in your approach, and then like if you're worried about that relatability piece, like trying to, find somebody that you could possibly connect them with, or just give them stories and stuff like that. We love telling stories. We're just folks love to hear stories, and so I think that's kind of something that could work. That you could possibly try to do. But that's a very good point. But I think that your awareness of this really helps, and really, excuse me, I'm sorry about that, really kind of highlights your concerns.
Thank you. I will just add to piggyback off what Brandon said. I agree. People can sense sincerity. They can tell when you are just reciting what you read off a pamphlet, or reciting what somebody told you in a meeting. They can tell when you're being sincere about where you're coming from, or your aims, what you want them to do, or look into. So I think, of course, as Brandon mentioned, the first step is just acknowledging the fact that may be a problem. In this country, we do have a history that has created and caused medical mistrust and distrust. That's just the nature of the beast of being a person of color in this country. It's something that we're going to have to deal with, and we do deal with. And I think the best thing that we could do is kind of address it by changing that narrative, coming from a place of sincerity and a real concern for the people that you are dealing with in your work. And so I think, if you take those things into consideration and just move from a place of I want to help, then people will fall in line, and people will understand that that's what you're doing. That's what you want to do.
One thing I'll add, Shayla, is lean into it. Don't shy away from it. I think when you shy away from it, then that's when I think people can kind of spot you out, right? You lean into it. Again, just come into it with the spirit of openness, and really just lean into that, and just kind of say, I don't know what this is like, or I don't know. But from what I've heard, or from what I would want for you is X, Y, and Z, and this is why, right? So I think that that if you just kind of lean into it and don't shy from it, that kind of helps too.
Thank you.
Yeah.
So we have another question, which I honestly think might be a little bit out of our expertise, but I will still read it. And if we have any providers or someone who is familiar with this on with us, please feel free to chat or put your hand up, and I can actually unmute you. But the question is, since it is best to start someone on PrEP the day of their appointment, if we start someone on Truvada and their labs come back with a GFR of, say, 40, can we immediately switch them to Descovy after a couple of days of Truvada? So I don't know if you are familiar with this, Brandon, but
Well, I'm not actually in practice, and so that's not my area. So I would not be able to actually comment on that, but I can get an answer for that. For the attendee that has that question, I can most certainly get an answer, and we could provide it to them.
Thank you. That's exactly what I was going to say. I'm not aware of that, and I will not sit up here and give medical advice with not having a license. So thank you. But we will find out the answer to that question and get back with you.
Yeah.
And I actually think that is it for the questions in our chat box. If anyone else has any questions, please feel free. We have a little bit more time before we close. But before we go ahead and close things, I know both of you work in the community, work within research and doing all types of amazing things that you do. So I wanted to take a second and kind of shine a spotlight on the work that you all are doing. So Graham, as a person that works in the community, what have you done in your perspective, professional life, to engage people that you meet on PrEP and kind of like get them like excited or wanting to take PrEP, or at least learn about it?
So what I will say is that in my current capacity at my office, so I do mental health work, and then I do work with people that are HIV positive and they're getting back into care. And there's some case management involved in there as well. Definitely if they have partners that are HIV negative, we do have that conversation, say, hey, we have a prevention department right here. We do have a clinic on site as well that can help your partners get started on PrEP. And that might be something really great for y'all when it comes to your relationship, right? I've also had a mental health client as well who was interested in getting on PrEP because they really wanted to start getting more active in the dating scene and what have you. So our prevention department, I think, is really wonderful. And they host groups. They do a lot of really great outreach, and they're really heavy-handed when it comes to the PrEP conversation, and I just do my best also just in my personal life generally to be active in the wider community in Lake Worth, in Wilton down here, and to learn as much as possible and to reach out to different groups and different providers, so that's basically it, just trying to stay active in the community at large.
Thank you so much for all your work in the community. Really appreciate it. And so Brandon, I wanted to give you a moment to kind of talk about your research. I know it's not directly related to PrEP, if I'm not mistaken, but could you please share some of the research that you have been doing or have done?
Yeah, sure. And so, it's not directly related to PrEP, but because I'm just a trained researcher, a lot of my research is focused on hookup culture. And even when you talk about these different things, it's hard for PrEP not to come up in the conversation. So I do always, when I'm collecting data, it always comes up in the conversation. And so, as I've mentioned, a lot of my research focuses on hookup culture and the use of dating applications and motivations and sexual behaviors that kind of stem from that. And so with that research, I was able to kind of uncover a lot of information about what people thought about PrEP, what they knew. And so this was a study as a part of my dissertation that I am working to publish now, that really found that a lot of people know about it. And it seems like most people are, at least in my study, were getting their information from friends and from family. They weren't getting their information from other sources. And so that kind of also influenced what they thought about PrEP, right? So if you have a friend who's like pro PrEP, right, then 9 times out of 10, you are more likely to actually, look into this. And then conversely, I found that there were some folks who had heard about it, but still thought that it was a still thought that it was a pill that kind of protects against all STIs, and or they may have knew about somebody on it. Sad to say that in that study that there was only, I believe it was about, maybe this was a sample size is a pretty small. It's a qualitative study, but only one participant was actually on PrEP at that time, who was in that study. Now, most of the folks who were in the study had also, they were using dating apps, they were hooking up, things of that sort, but only one person was actually on PrEP. And I think there were two folks, if I can recall, that were actually living with HIV. So that kind of, excluded them from out of that conversation, but only one, right? And so I think that we still have a lot of work to do when it comes to, it may sound just kind of basic, and we have to reiterate and use this messaging with PrEP to make sure that it's really getting out to folks, and that it is really permeating in folks's close circles, because this is where folks are getting a lot of their information from. I mean, look at what we're going through now with COVID, right? Folks they just click and, open up social media, and then they're getting their information there. We need to be in those spaces, which we're doing a good job with that now, with reinforcing these messages, and really have folks who are peer navigators, things of that sort, who are actually on PrEP to, again, give folks this information, because a lot of the times they're not going to run to, as much as we say, oh yeah, I have a conversation with your doctor. Some people don't want to have a conversation with their doctor. Some people just want that to be very transactional and wham bam, right? And so they're going to have a conversation with their friends. This is going to come at, this topic will come up at brunch, right? It's going to be a conversation. So having folks who are equipped almost as, I'm trying to think of the, almost like as gatekeepers, right? Or almost as, promoters. There's another word that I want to use, but it's escaping me right now. But as folks who know about this, to talk to their friends about it. So that way, if somebody's saying to you, that I'm doing this and I'm doing that, and they're explaining all of these different behaviors that might put them at an elevated risk, then a friend can say, a trusted friend can say, a peer leader or somebody can say, yeah, you know what, you might need to think about this, because folks are getting their information from this. So if you have, any questions about any type of specific research that I do on sexual behaviors, sexual hookups, or like social media dating apps as well, then my information will be available. Shayla, please feel free to pass it along, so that way we can have those conversations.
I definitely will. Thank you so much for that. I really appreciate you sharing your research with us. Thank you. We have one more question that popped up in our Q&A box, and it says, any thoughts on PrEP guidance, which makes all PrEP services, including labs, medical visits, or other things, free for patients? I can jump in first. I think having all of these services free for patients increases the access to PrEP, because I feel like the first hurdle, of course, is like actually getting to a provider that prescribes PrEP or is aware of PrEP. And then the next hurdle is the cost of PrEP in general. It's very expensive. However, there are services and organizations and programs and all types of assistance, things that can help pay for the cost of PrEP medication. And then you have to think about the cost of the actual medical visits in the labs themselves. So I feel when they're free, it does increase access. So I'll pass it over to the two of you if you have any thoughts on that as well.
Yeah. So
Oh, go ahead. Please go ahead.
No, I was just gonna say that what I do recognize is, like I said, I began this session saying that like I'm someone who has insurance through work, and in that way I'm privileged. But I will say too that when I first got my first fill of PrEP, the pharmacy, they almost just went ahead and signed me up for, I think it was the Gilead copay card thing. And I will say to this day, I've never paid anything out of pocket for my PrEP in combination with my insurance, right? So I haven't had to pay any copays out of pocket for my PrEP, which has been great. So and I know that there are also different avenues by which folks that are uninsured can navigate access to PrEP. So, and I know that like at my agency, our prevention department, they're experts at that. So.
Yeah, so just to comment about the guidelines, I do think that it's important to highlight that there are a lot of structural barriers that exist, such as insurance and things of that sort that may impede folks actually being able to start it. So it's important that it be made available, right? And that we address these structural issues that are going on to, again, like you've mentioned, Shayla, to provide access, because if we don't, then a lot of people will start falling through that net, right? So then the first little safety net that we have, we can catch folks, but then some folks may still slip through there, right? And so by eliminating those types of barriers, these structural things that exist, then we can get, in turn, more access to folks as well to begin to do it. And so, yeah, that's my tidbit about the guidelines.
Thank you.
And thank you, Kwasia, for putting that, like, PrEP ambassadors. Lord have mercy, it was escaping me. I was just like,
Yeah.
trying to like fish for it, but thank you so much for adding that.
Yeah. Hi, Kwasia.
Right. Hi, Kwasia. So our last question that just came in, which I'm going to go ahead and read it. This is, can you talk about the 2-1-1 method and your approach when individuals ask you about it and then want to take it in that method? So I've gotten questions about 2-1-1 before, and I always lead with the fact that that is not an FDA approved way of taking PrEP. And so it's very difficult to kind of have that conversation because it is not approved. However, there have been studies that have been conducted in other places that have, found it to be effective. But to my knowledge, when you're talking about 2-1-1, because it's not FDA approved, it's an off-label way to prescribe it. And so when people ask me about it, I make sure that I let them know I'm educated about what 2-1-1 is and what you have to do to take it. It is, in my opinion, is very complicated because there's a lot of different nuances that go in there, like the amount of encounters that have been had, the time frame. There's a lot in there. So to kind of just give a blanket statement on that, because it is not FDA approved, I just educate people on it, but I don't say this is what you should do because it's not approved. It is an off-label way to prescribe PrEP. I don't know if you all wanted to add anything about that.
Yeah, I usually say the same. I'm very aware of it. I know folks that actually, do use it that type in that fashion, but my messaging is usually the same, Shayla, to just kind of echo a lot of the things that you have said. I think that it is the next generation of biomedical interventions. I think that we will eventually get there, and then we'll have maybe stuff to obviously studies that have been conducted to support something like that, obviously being FDA approved, but we're just not there yet, just like with the injectables for PrEP, right? So that type of stuff is coming, and it takes a little bit of time to make sure that these things are working and that they're everything's being tested and checked off. So I always tell people, it's just not a no, it's just that we're just not there yet. And so while we're not there yet, we still have these other options that are available until we get there, because we will get there. Look how far we've come, to this point, right? But we're just not there yet.
Yeah. I've heard of 2-1-1 as well. And for anyone who's listening, basically it's a way of taking PrEP that, again, is not FDA approved. And as far as I know, mostly I think it's a lot of non-American bodies that have been looking into it and approve of it. But basically it's a method by which folks that are taking PrEP take PrEP around points at which they believe that they're going to engage in sexual intercourse, or points at which that they believe they will be at risk, and only around it. So they call it event-based PrEP, basically. And yeah, I've been in circles. I've been in circles where people talk about event-based PrEP. Again, it's something that's not really approved in the United States, definitely. But Dr. Brandon, I do like how you said it, that, you know, it's not a no. It's not as if it's something that we know 100% for sure does not work, or 100% for sure is less effective, or what have you. It's just when it comes to the powers that be, we're not at that point yet, you know. So I do say, if you do have access to PrEP, and if you are able to take it on a daily basis, I know for me, I am able to take it on a daily basis. It's been easy for me that way, you know. But talk to your doctor, have frank conversations with your doctor. Yeah.
And if that's the best note to end our conversations on today, what we talked about a lot of stuff, but one thing we can go away and say is talk to your provider about PrEP. If it's not for you, you can at least introduce it to your provider, and they will be aware of it for the next person coming. So it's not, you know, it doesn't have to be only for self. We can, you know, spread this education and help a lot more people know what PrEP is for, and that it's an effective prevention strategy for HIV. So I want to thank the both of you so much for joining me today. And I will, if anyone is interested in the contact information for either of our panelists or myself, please feel free to reach out. I will definitely forward that information to you all. And thank you so much for joining us.